In this MedMastery lesson, I'll show you imaging of splenic, liver, and pancreatic injuries. Let's review the most common injured organ in abdominal trauma, the spleen. When the spleen is injured, there is usually some blood around it. Additionally, the presence of overlying lower left rib fractures can raise suspicion of a possible splenic injury, as the two often occur together. Preserving the spleen is a priority following trauma due to its important role in immune function. Accurately reporting splenic injuries helps the trauma team understand the extent of tissue and vascular injury, which will help direct next steps in management. Subtle injuries on the surface of the spleen are small hematomas with subcapsular blood indenting the splenic tissue. Here you see tearing of the organ tissue, which is called a laceration. Lacerations often follow a linear or branching pattern and can extend partially or completely through the spleen. When they extend to the hilum, there is an increased risk of vascular injury. This is a more severe injury with a large, branching laceration which extends towards the hilum and has caused vascular injury. On the coronal image, the lower half of the spleen is seen to have lost blood flow and infarcted. This little blush of bright contrast within a laceration indicates a traumatic pseudoaneurysm where an injured blood vessel wall has caused blood to leak and collect outside of the artery. Pseudoaneurysms need to be followed and considered for embolization therapy due to the risk of further bleeding. A shattered spleen is the most severe type of splenic injury, and it usually requires surgical attention. This case of severe splenic trauma has branching, complex lacerations causing complete disruption of the organ tissue. This type of injury is often associated with active bleeding. On the coronal image, you can see bright jets of contrast emanating from the injury. Active arterial bleeding will be similar in brightness to the aorta, as they are both comprised of contrast-opacified arterial blood. Many trauma scans will have delayed phase images taken a few minutes after the initial scan. On the initial scan, active bleeding will be a similar brightness to the aorta. On the delayed images, that bright contrast will disperse and fade into the surrounding blood. The liver follows a similar pattern of injury as the spleen. Liver injuries range from subtle subcapsular hematoma to lacerations of various depths and complexity. Here you can see thin lacerations of the posterior liver, which are relatively subtle linear areas of decreased enhancement. In this next image, there are branching, complex lacerations throughout the liver extending towards the hilum. Here you can see an extensive, complex injury to the liver with large, branching lacerations anteriorly and a severe devascularization injury resulting in decreased or absent enhancement to much of the posterior right hepatic lobe. Pancreatic injury is relatively uncommon due to its deep positioning in the abdomen. It is caused by severe blunt trauma and is usually associated with severe trauma to other organs, especially duodenal injury. In this example, there is a thin, linear laceration through the pancreas tail. This might be easy to overlook, but the surrounding dense fluid and adjacent splenic injury help raise your suspicion. Pancreatic injury should be considered when there is surrounding blood, linear lacerations through the pancreas tissue, or disrupted enhancement. In this example, a more severe injury has resulted in transection of the pancreas neck. The direction of blunt trauma through the anterior abdomen can be inferred from a large liver laceration that points directly at the pancreas injury. In this example, the pancreatic tissue is enlarged and enhances less than would be expected, especially compared to the normal pancreatic tail. This is consistent with a large devascularization injury, which was later confirmed by MRI. Now you can recognize splenic, liver, and pancreatic injuries on CT imaging.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.